Primarily I'm a cancer biologist and my main background is in breast cancer, but more recently I've also been working in ovarian cancer, and I'm trying to kind of look at ways to personalise treatment by developing biomarkers. And really what I want to do, and my research aims, is to try and understand the biology that's driving the diseases and then use knowledge of that to treat patients more efficiently. I think the fact that you can longitudinally screen patients, it means that really we can actually start looking at people before there's ever any disease present. It's really going to be something that every patient will really have, or every person will have their own unique bit of data behind them, so that we know that when things start changing, it's really based on their own baseline information. We're not going to be looking at people as how they are changing relative to everyone else. It's going to be how people are changing relative to themselves. At the moment, the biggest challenge is the technical validity of any of these assays. In order for them to work, we're really working at the limits of detection. We're down at looking at things like at the 0.1%, and trying to get that technical specificity above the noise is going to take quite a while to get there. But we really are making strides, and I think the recent ASCO and CAP report has highlighted that optimism in the field. We're still at that stage of trying to transition and migrate our assay from a tissue-based assay to a liquid biopsy-based assay. And it's going to take a bit of time to try out all of these different platforms, work out what works best for us, and also what works best within the routine pathology workflow. As a scientist, sometimes we can get carried away with what is the best assay, but sometimes that's not the most applicable assay and the most useful assay. So it's kind of balancing that kind of specificity, but also with usefulness and applicability within the routine pathology workflow. This is my first time at Pathology Horizons, and I've really enjoyed it. It's a really broad mix of people who attend the conference, and also there's been a really broad range of talks and presentations. And as a scientist and as a researcher, I've really learned so much about where my research fits in, and I can see how things maybe that I would have researched 10 years ago are really now routine within clinical practice. And we can see all of this and how also it needs to change and where the future lies.